And so today we stand at a moment of opportunity for this campus as it prepares us for the challenges of the years ahead. Lots and lots of discussion about healthcare reform, lots of debate, and we now have a new law. And it's time for us at Christiana Care to step forward and help to plan on serving our community in ways even better than what we've done in the past. So what you see over the railing here, don't lean out too far there, the safety guys will be mad at me there. But over what you see here is an investment very much in the spirit of healthcare reform, looking for ways to enhance the services that we provide to our community. Specifically, you'll see enhanced emergency services because those are so important. New operating rooms bringing the wonders of the technology that my colleagues, surgeons and anesthesiologists and nurses bring to help people live the lives that they want to live. And new intensive care and step-down units, helping people to get better quickly so that they can go home and do the things that they want to do. And overall, a redesign of the campus to make it simpler for people to access services so that they can get better and live well. Now these changes, most prominent the physical changes that you'll see, are bigger than that. They are changes in process that my colleague Dr. Janice Nevin, who leads the effort here, is essentially reinventing the way that we practice medicine. And we believe that they will have an impact not only in our local community, but throughout the state and frankly throughout the region. And that's why it's so important in this time of healthcare renewal, of enhanced commitment to service of our community far and wide. That's so important and significant that AstraZeneca has decided to partner with us to make that happen. And they deserve applause just for that. AstraZeneca really steps up. I mean, these are just wonderful people and a wonderful organization. And you see them everywhere, working to help make our community and the communities throughout our country, frankly, throughout the world, a healthier place. So when we were thinking of partners to help make our vision of service real for the Wilmington campus, it was easy to see that absolutely I should speak with AstraZeneca and with Rich Fante in particular, and see if we could partner with him because their vision has been a spectacular one, and it's one that we should work with. So I'm deeply grateful for their help, their cooperation, and their investment.
AstraZeneca and Christiana Care's collaboration over the years has been guided by a very singular focus: to help improve patient health, and as a result, create stronger, healthier communities, not just for our neighbors here, but also for the employees at AstraZeneca. And we have several thousand right down the street on our Wilmington campus. Now, when Bob and I met on this campus last October, and very similar today, we're in the middle of a pretty significant economic recession. But I was got to tell you, I was impressed by his motivation for moving ahead anyway. And it was strongly rooted in his desire to improve the community and the medical quality of care in the community. And I think this project will do so much to help healthcare options for Wilmington residents and the entire region, actually. And we're proud to contribute to such a worthy cause. Now, what's being built here demonstrates the importance of healthcare providers, public and private organizations working together to address urgent healthcare needs for so many. The thousands of people who depend on the Wilmington Hospital will benefit greatly from our collective willingness to pursue a common good. Now, AstraZeneca has been very pleased to work with Christiana Care and other partners on a number of programs, including Healthy Delawareans Today and Tomorrow, the Helen F. Graham Cancer Center, the Governor Ruth Ann Minner High Risk Family Cancer Registry, and the American Cancer Society's Patient Navigator Program. And very recently, just a few weeks ago, we announced that AstraZeneca made the single largest monetary contribution in our company's history, $25 million, to our healthcare foundation. And Christiana Care's Center for Heart and Vascular Health received the very first foundation grant to help increase cardiovascular screenings in Wilmington. And today, we're here again to help Christiana Care deliver on its commitment for patient health. I'm pleased to announce that AstraZeneca has made a $1 million gift to support the renovation and expansion of the Wilmington Hospital. AstraZeneca is indeed investing in a very special place, and we can all appreciate the value of quality care from an institution that you and me and my employees can trust. In closing, I will return to my opening theme, and it's something I really believe very strongly. This $1 million contribution demonstrates our understanding as a company that a healthier world cannot come from just medicines alone, but also through collaborations with all our stakeholders. The common good is best preserved when companies like my own, healthcare providers, not-for-profits, and other interested parties come together to address key healthcare issues. When we work together with organizations such as Christiana Care that are committed to improving patient health, only then can real progress be made. In this case, patients at Wilmington Hospital will benefit from top-notch, innovative care for years to come.
There's really not a whole lot for me to say other than when we have an opportunity to bring these world-class organizations together in such a way, this is what it's all about. And to have AstraZeneca, which is such a fantastic employer in Delaware, such a, I love companies that put people to work saving lives. And that's what we have in both AstraZeneca and Christiana Care. And to have AstraZeneca making this commitment, to have Christiana Care, as Rich said, even in the face of a difficult economic time, pushing ahead with this project. And I'll tell you, having this event up here where we hear those people working in back of us, I mean, this is a very significant number of construction jobs, as well as ongoing jobs beyond that. We do continue to live in really challenging times. We released today the latest employment figures for the state, and fortunately we had a bit of a dip, a 0.2% dip, 1,300 more jobs, 1,300 more people employed this month than last month. So it's a good sign, but we've got an awfully long way to go. And this is why we wake up every single day focused on how we make the economic climate in Delaware even better, or much better than it's ever been before. And that's what we have to do. And particularly at events like this, I think back, you think about AstraZeneca, there are plenty of places where their headquarters could be. It happens to be here in Delaware. And there they are supportive and philanthropic across the country and around the globe. But the fact that their headquarters is here means that we share disproportionately in their generosity. And Senator Carper, I know, is on his way, but if you think back, about 10 years ago, AstraZeneca had a choice about where it was going to put its North American headquarters. In other words, essentially, they thought about Delaware, they thought about Pennsylvania. Senator Carper led a great team and a great team effort, and in the end, they're here in Delaware. And that's really the kind of thinking that we've got to go through every day, because this is the implication. 10 years later, because of that choice that AstraZeneca, a different leadership team at the time made, they chose Delaware, and here we are 10 years later with this $1 million check being made to being made out to Christiana Care. And so our job is to figure out every day how we make the economic climate better and how we create more jobs here right in our state. And being able to point to employers like AstraZeneca and Christiana Care, and being able to tell other employers that when they come here, that's the kind of corporate community that they're going to be a part of, and they're going to be able to get the quality of care that Christiana Care and our other institutions of health care provide. It makes our jobs a whole lot easier. So